Tell you what, the climate accord decision was not the only thing coming out of the White House. The Hill newspaper is reporting that this administration is about to make some changes into Barack Obama's birth control coverage mandate. Remember that mandate he added that Hobby Lobby and a bunch of other companies, when it came to Obamacare, pushed back on some of the mandate stuff. This was a little different than that, mandating birth control coverage and not giving much flexibility for any company to back away from it. That may be about to change. We're joined right now by Melanie Israel, who's with the Heritage Foundation. Melanie, how are you?
Hi there. Doing great. How are you?
I'm well. Great to have you back on the show again. Do we know, is this coming? Is this decision pending this week maybe or next?
Well, it definitely looks like something's coming, and we should be clear this isn't final yet. What they've done is various departments, HHS and others, have sent over a draft of an interim final rule that's going through basically an interagency approval process. So the draft that we've seen could change, but the fact that they've sent it over indicates that they're pretty sure that what they have is rock solid. So basically what it's doing, it's looking like they're planning to offer very, very broad exemptions to individuals, employers, insurers for both religious and moral reasons, which is a very, very important key development in this fight that's been going on literally for the last 7 years.
Well, let's be clear on what the mandate was. What did it mandate to companies and insurance companies?
Sure. And this is another key thing to remember is that the statutory text of Obamacare itself doesn't say anything about birth control. What it says is that certain preventive services have to be covered, and Obamacare said, okay, agencies, now you guys work out exactly what those services are going to be.
Okay.
So that's where HHS came up with this list of the different things that should be covered. And so that's what people were objecting to. This birth control mandate is not statutory in nature, so of course any administration or folks at those agencies can go in and change it.
Which is what we may be about to see. So it would give more latitude to, a company like I'm just picking one out of the air here because I don't know. I know that the Cathy family that own Chick-fil-A are deeply religious people. I know I read up on them. If they decided that went against their beliefs for some reason, this change in this rule might give them some leeway on that. Correct?
Right. And again, this is not about trying to take away access to birth control for the people who do want it. It's about saying that for those people who do not want it, they now have a way out. Birth control is still going to be widely available, very affordable. There are literally dozens of different government programs at the state, federal, local level that help provide access to the people who need it. But getting access to people who need or want to get birth control shouldn't mean that other individuals and employers and insurers should have to violate sincerely held beliefs or pay steep fines or forgo offering or obtaining health insurance entirely. And so this is really geared towards getting a win-win situation for people who want or don't want coverage of these drugs and devices.
And just to be clear, what about the no cost? I mean, in a lot of cases, there were no out-of-pocket costs. Was that part of the mandate? Did it have to be provided with no out-of-pocket cost?
Right. So that was in the mandate about we want these preventive services to have no copay, essentially free. Of course, what may be free on paper, that doesn't mean that somewhere down the line costs have increased elsewhere. And so, again, what this is saying is that other affordable or, in some cases, free contraception will still be available to those who want to obtain it through other programs. There's other things like Title X and different affordable clinics throughout the country that operate on a sliding scale basis that depends on what your ability to pay is. This isn't touching any of that. What it's saying is that for those individuals who don't want to have this coverage, they're now going to be able to get an exemption.
Very good. Well, thank you for updating us on that, and we'll keep our eyes peeled and see if that's something that gets rolled out here in the next week or two. Melanie, thanks so much. Direct people to heritage.org, and you also write for the Daily Signal, correct?
That's correct.
Awesome. Thanks for your time.
Thanks. Have a good day.
You too. Thank you so much. So that may be coming next. We're going to keep an eye on that. This story just coming down from an alert just got put out from the Post-Dispatch. Let me read this to you. The mayor of St. Louis, who has a lot on her plate these days after multiple shootings the last couple of days, including critically injuring children, she's more focused on adding regulations to the St. Louis city businesses to try to somehow do her own enforcement of the Paris Climate Accord because she's smarter than the President of the United States. So instead of worrying about the crime that's happening in her own city, killing people, she's worried about something that might or might not happen 100 years from now. That's the focus of Mayor Krewson, it appears. Also, she's announced today, on the heels of another bloody week of violence in St. Louis, this is from Kim Bell at the Post, Mayor Lyda Krewson said a tax hike might be the best way to increase the salaries of city police officers and to hire new officers. She's trying to find a way to fill the gap when city officers leave for better paying work as a St. Louis County police officer. And they think they need only close to $20 million annually. It's either going to be a property or a sales tax, she said. So for all of you folks in the city, buckle up because